Would you like to see a feeding therapist do a full pediatric screening on a patient? If you're like most clinicians, you want more than a textbook description. You want to see an example of how to screen both a typically developing child and a child with a pediatric feeding disorder, right? I mean, how much more confident would you feel when you see your next pediatric patient if you already had some successful screenings under your belt? The best way to elevate your screening skills is to have a proven process to use with every patient. Then you'll know exactly what to look for. I'm Hallie Bulkin, speech language pathologist and feeding specialist, creator of Feed the Peds and the Elevation Movement. I've trained over 11,000 SLPs and OTs to screen pediatric patients for feeding disorders. And I've trained 1,036 pediatric feeding therapists through the Feed the Peds course. I'm also a mom of 2, and I've experienced pediatric feeding disorders firsthand with my kids. I'm hosting a 5-day challenge really soon, and when you register, you'll get to do pediatric screenings on 2 patients. And don't worry, I'll provide the pediatric patients for the challenge, and the challenge is completely free to you. You'll get a chance to screen them on your own, and then we'll go over the screening results together. Having mentorship like this is the fastest way to begin elevating your pediatric feeding skills. As a part of the challenge, you'll get my pediatric feeding screening packet for free. There is a super simple 1-page developmental milestone chart for ages birth to 36 months. This way you know where your patient should be developmentally. Plus, it's got a checklist of the 50 most common symptoms, so you know exactly what to look for. And of course, you'll get to do a screening of my daughter who has feeding issues, and then we'll talk about how to make sense of those results and what to do next. I'll also share how to launch yourself into assessing and treating pediatric feeding patients. So click the button around this video to get registered for the 5-day challenge and take the guesswork out of screening your pediatric patients. Remember, our patients, especially the littlest patients and their families, need us to recognize their symptoms and screen them. And they'll have you to thank when their disorder gets identified and treated.